Hello, everyone. I am so excited to be talking with Douglas today. But before we get started, I am going to just do a short introduction of myself. I am Megan Claire Chase, also known as Megsy in Cancerland, and I am on the editorial board of Oncology Data Advisors, and I'm also a breast cancer survivor, invasive lobular, going on almost 9 years now. And yes, right, and a patient advocate and activist. So I'd like to toss it over to our guest today. Douglas, take it away.
Hello, my name is Douglas Feil, and I'm the Chief Program Officer at the National Breast Cancer Foundation. We're headquartered in Frisco, Texas, which is about 30 minutes south of Dallas, and it's a beautiful day here. But yeah, we've been around for over 30 years. We were actually founded. I don't know if you want me to go into our sort of our history, but we
Please,
were,
yes.
yes, we were founded in 1991 by a breast cancer survivor. Her name is Janelle Hale. She's still with us today. She was diagnosed at 34. She had three young sons, and at the time, there's no internet, there's no information. People aren't talking about breast cancer. Screening programs are just getting started, and she felt like she had to make decisions about her health without information. And so she founded NBCF in 1991. It's now what we're almost in 2025. We've seen remarkable progress in breast cancer, but we still have a long ways to go, which is why we're still here.
Absolutely. Can you just kind of give us more information on what it is that you do for NBCF and, what are some things that you suggest that patients view on your website?
Yeah, so our website's nbcf.org or National Breast Cancer Foundation.org. And our mission at NBCF is to help now. And we really want to help patients who are recently diagnosed or going through breast cancer today. A lot of times, I think when you think about breast cancer nonprofits, you imagine, research and looking for, we've sort of been conditioned in our industry to look for a cure, talk about a cure. Well, while that is important, and we do need we need new therapies for breast cancer. What about the person who is diagnosed today? What are their needs? And so we really focus on that. And that's why our sort of three pillars of what we do: early detection, education, and support services. We believe that no one should face breast cancer alone. And we really want to be there at every step of the journey. So early detection, we fund hospitals all across the country in all 50 states, and we still provide free mammograms, free free diagnostic services for people who may be uninsured or don't. Maybe they're underinsured. We don't talk about that enough, right?
Right.
Um, and I think we forget that even though insurance has gotten better in our country, there are still over 10 million uninsured people across the country who cannot afford, we're talking about early detection and saying, we need to get our mammograms. We need to start at 40 once a year. But if you can't afford the cost and you're uninsured, how do you navigate the system, right? How do you go
Right.
in and schedule an appointment? And so that's what we're there for. We fund those. We fund free mammograms in all 50 states. We also fund patient navigators in hospitals across the country as well. And you know what navigation is.
As you're ready to say, why don't you tell our listeners what patient navigators do and how valuable they are in the journey?
I love the story of navigation. It was started by Dr. Harold Freeman, in the early 90s, 80s. He noticed that he was a doctor at a breast center in Harlem, and he noticed that he could literally draw a line on the streets. The streets are numbered in Manhattan from 1 to 125th. He could see that people below 125th were surviving breast cancers. They were finding that they were going to their local hospitals. They were finding them early, but then up in the higher streets, they were being diagnosed later when they were stage 4 and they were dying of breast cancers. And he saw a huge disparity. in his patient population. So he thought for many years, what can I do to sort of remove barriers and to save lives? And so he created patient navigation, which is a concept of literally removing barriers to care. It could be costs. I just mentioned insurance. It could be lack of understanding or education or not understanding the importance of early detection of breast cancer. It could be transportation. It could be food. It could be all the things that we think of, anything that could get you in the way or could get in the way of screening early or getting access to treatment early and getting access to quality care, right? I always describe it this way. You know, sometimes you're in a race and there's somebody who's running a 100-yard dash, and then there's somebody who has to run the hurdles. And that's what navigation does. It goes in and removes those hurdles so that you can run the race along with somebody who doesn't have to jump over hurdles to get care.
Yeah, as someone who has gone through it,
Yes.
and I had invasive lobular breast cancer. And the thing is, there's so many elements to the journey from, and then if you end up with a diagnosis, and for me, I was under 40. Like, I wasn't even old enough to get a mammogram covered. I always like to say that because anyone can get a mammogram at any time, but to get it covered by your insurance, the guidelines are you need to be 40. And I just remember being very overwhelmed once I got the diagnosis because I didn't understand all the different expenses that come with that diagnosis, and I wish I had a patient navigator. I did have a social worker, so I'm wondering, can you kind of give a differentiation on between a patient navigator and what an oncology social worker does?
Ooh, that's a good question. I mean, I think, and you maybe jump in and tell me as well, like your experience. I mean, navigators, a lot of times you got different kinds. I mean, a few years ago, we partnered with Aon, which is kind of like that's the Academy of Oncology Nurse Navigators, but they've expanded their sort of definition of what a navigator is. In the past, it was like a trained nurse who had specific things that they were going to navigate you through in terms of breast cancer, whether it be making sure that your wait time between a suspicious finding and treatment was short, or and so I think a social, I'm assuming, you tell me too, I would say a social oncology worker is going to cover everything. They're going to cover if you are talking to your doctor or you're talking to your care team and I know I need to go to chemotherapy, but I can't get here. I don't have a ride. A social worker is going to make sure you get a ride. They're going to make sure that or I can't afford this treatment. I'm not going to be able to afford my, bills and be able to pay for food for my entire family and do this treatment. That's what a social worker is going to help you with that. A navigator is going to make sure that you get to all your appointments, you get there on time. Is there, look at your insurance forms, make sure everything's being submitted properly. If you have any questions, because a lot of times you have to go to different doctors. I'm sure that was your experience as well, just navigating the complex cancer system in general.
Well, no, because I've often asked the question. So my experience is I didn't even know what an oncology social worker was, right? And so when I was diagnosed, it'll soon be 9 years come next year in March, right? I mean, it's just like amazing. How am I still here? And no one told me about this resource, right? And the only way I found out is because I read every single sheet of paper I was given, and it was text heavy, like and I'm just like, what is that? I was just curious because I didn't understand the term. I'm like, I thought a social worker was DFACS, and I was like, but it says this is assigned to my oncologist. So what does that mean? And I thank goodness I did call because she was instrumental in helping me find grants to pay for my chemo, to pay for my radiation, to also help pay for some of the medication to help manage side effects. And so then when I started to see the rise of patient navigators and then nurse navigators. So it's like everyone has like a very specific specialty and a different type of training. And so I wish that this was the standard of care everywhere, that everyone had access to one of the types of fantastic people to help you navigate the system. And I love what your organization does and making sure to spotlight this resource, because that's the thing too. You don't know what you don't know as a patient, or your caregiver doesn't know what they don't know. And I think, spotlighting that you do have patient navigation is huge and a major resource that is so needed. And you don't even realize how much it is needed until you see how much they take off of your shoulders so you can focus on being the patient.
Absolutely. And also, you think of social workers as well, your mental health is affected by going through, we don't think about that too. A lot of times we've got to get our physical bodies cured or treated for this disease, but what about your mind and the toll it takes on you? So a lot of times social oncology workers also make sure that you're feeling okay, that you're mentally, we talk about mental health a lot now. It's really important, and it's really important to your quality of care, but also your outcomes. It's really important that you do the best you can to feel good about what you're going through, because it's really hard. And if you need counseling and you need therapy and you need to talk to somebody about it, or your family needs to talk to someone about it, or your caregiver, it's really important. So all those things need to work together.
I recently came back from the ASCO Quality Care Symposium, and we were talking about just this, right? And when we think about the financial aspect, and I love that this organization, partners with cancer centers for that piece. I was wondering if you could talk a little bit more about that and how, that has helped patients and their families get through the treatments.
Yeah, I mean, I think the best way to share it is through kind of stories that have heard over the years. I remember we had a patient not too long ago who contacted us, and she was recently diagnosed with breast cancer. She was young. She was probably maybe late 50s, early 60s. And her kids were grown, but they were just starting to talk about having, kids themselves, and she wanted to be a grandmother. And she went in, she found a lump. She waited a little bit, but a little bit longer than probably she should have, several months actually, because she was afraid. She was afraid to go. But we finally got her in. She was diagnosed with breast cancer, but she went to a hospital, and I'm not going to name names. I'm not going to tell you where it was because I'm just not going to do that. But we all know that all the care is not equal everywhere, right? And
Right.
to get care, and she saw the first bill just for the workup, and she was uninsured, and it was like $17,000. They had no insurance in their family. This was just the workup, so the biopsy, the screening, and so
Right. Haven't even gotten to the treatments yet and surgeries.
right, exactly. So she looks at the bill, she thinks about all of this, and she says, I'm not going to be treated. I'm done. I'm going to let fate, you know, let it be. And so we met with her and we said, no, you can't do this. And her daughter actually was starting to have children. She was going to be a grandmother. And so we said, why don't you talk to we have a navigator in your county who this hospital in this county is known throughout our community for helping people. So we just said, just go talk to a navigator. So she sits down with the navigator and she said, you need to talk to a financial navigator. So this hospital network had a navigator just for insurance and just for navigating finances. So she sat down with that navigator, the financial navigator, and they said, not only are we going to, you qualify for a program to have all of your treatment covered, but also bring us your bill because that's covered too.
Oh
You
my goodness.
know, to pay for the 17, that's covered under this program that you qualify for, and your treatment's covered. She was in treatment immediately, and she survived to be able to see her grandchildren uh, be born, and her life was extended. And so a lot of times people just don't know what's out there. And that's why navigators, that's why social oncology workers are so important, because if you're just going to your treatment care team, you know, they're experts on chemotherapy, they're experts on surgery, but all these other things affect your treatment as well. And if your back's against the wall, you may choose just to not even go to treatment.
Yeah, that's so true. And what I love on the website is your FAQ section. Because even as you're going through treatment, and then if you are one of those that does enter that survivorship stage, got that fear of recurrence. What can I eat? Dairy. I saw that as like the top question, because I remember I even asked that question. Well, what about dairy? What about this? Because
Yeah.
there's just such a panic on, I can't go through this again. So I want to do absolutely everything I can to, within my power, within my, so I don't get a recurrence. And I was wondering if you could talk about, like, with your FAQ section, and like most other types of questions that are asked, how do you as a foundation come up with those? Do you talk with other patient advocates? Talk to us a little bit about that.
That's a great question, and you kind of answered it. We do talk to other patients.
Mhm.
A lot of that is informed. We have a really broad reach. Our reach is really millions of people across the country. If you go on our social channels, I mean, we put a lot of investment into reaching people, and so they absolutely tell you what they want to know or the questions they want to hear about. So all of that is absolutely informed by patients telling us these are our questions. We also have a medical advisory board that helps us sort of navigate, I'll say, use the word navigate again, information and how we need to share it, because there's a lot of myths out there. If you've been on, the internet could be your best friend, it could be your worst enemy, right?
Right.
Down a dark place. I think you mentioned that earlier. But it can also be helpful. So that's what's so great about our mission. We really just want to be helpful. So if there's a myth out there that's not accurate or not evidence-based, and it's kind of just a myth, we want to say that. We want to say, you know what? There's really not any evidence that this is linked to breast cancer. However, if you want to be healthy, here's some tips, here's some nutrition tips, here's some things you can do to reduce your risk of either developing breast cancer or reduce your risk of recurrence.
And speaking of recurrence, so I absolutely love that you have this recurrence ebook. It's volume
Yes.
2 now, and I just put in my name because I was like, oh, I need to get a copy of this. And I was wondering, how did that come about? What a great idea.
I mean, it really was patients telling us on social and on all of our marketing team's wonderful. They really listen to people, and so that was one of our top questions. How do I prevent recurrence, or how do I reduce my risk of this happening again? And I believe the author is, I believe, Lily Shockney, kind of known in our industry as one of the founding nurse navigators. She was at Johns Hopkins for many years. She's on our medical advisory board, but I believe she wrote both versions. But she's one of the foremost. She was a professor of breast surgery for many years at Johns Hopkins, and she just knows everything about breast cancer. But she also has a passion and a heart to help people and to give people hope that is, this is kind of a weird word, but applicable, palpable hope, not hope that's not real, or,
Yeah.
Do this and you'll be fine. That's not real hope. Real hope is getting information and finding out what you can control and what you can do to reduce the risk or reduce your chances of having recurrence. Some things are out of our control, right? Once you kind of understand how breast cancer works, some of it's out of our control, right? But some of it is in our control. So what can you control? What can you do? And I think that's what helps people and empowers them and gives them hope. It's like, this is what I can do.
Yeah. I love that. Palpable hope. I love that. I'm going to start using that.
I don't know. I'm not the best at coming up with things like that, but you need hope that you can do something about and not false hope, right?
So true. So true. So, Doug, tell us a little bit about the NBC retreat that you have.
We bring about 8 patients and their caregivers to a retreat over the weekend. And we just go through, like, what are your hopes for the rest of your time and what are your fears? And usually people come in, their fear level is like 8 or 9, and they walk out of there at 2 or 3. We've just, by the end of the retreat, they've really reduced their fear. A lot of them, we're starting to study this a little bit. Some of them are living longer just from getting all of the information that we do. We talk about palliative care, hospice. We make plans, end of life plans. I mean, it gets really kind of deep, but it's how we work with Lily Shockney.
A lot of friends diagnosed with metastatic breast cancer. And I talk about it so much that people often think that I do have NBC. And I'm like, no, but I do feel early stagers need to understand NBC because we are all at risk after our initial diagnosis. And you can go literally from stage 0 and then, 5, 10, 20 years later become metastatic. And that's information that's still not given to early stagers. And I do a lot to help myself understand the experience so I can share it and kind of take away the fear, because what happens is these two communities tend to, there's a lot of friction there, and it's not about the metastatic community wanting to, take away the joy of early stagers for getting to that survivorship stage where they are done with treatment. It is more about that information and saying, yes, have that joy. Like, you should celebrate. It is hard getting through the treatments, and everyone has a different experience, but also just be aware of what could potentially happen down the road. Not saying it will, but just know that information.
Well, statistically, yeah, when you look at the math of it, yes, it's hard you don't want it to be you, but the math is the math, right? But also, when we talk to metastatic breast cancer patients, they really just want to be understood. They want people to understand what they're going through. So and that could be anybody. It could be me who's never had cancer. I mean, I have it in my family. That's kind of my story, but, or it could be early stage. And I would even say early stage, it's more important because now how, when you're confronted with somebody that says, I'm stage 4, you know how to talk to them. And it's probably different a little bit, right?
Yeah. And, and also recognizing too that in the metastatic community, time is of the essence, and I think it's understanding, even in thinking of research, if we can figure out why there's a metastasis happens, maybe then we can actually get to like the cure of all early stage and metastatic, so it's just the importance of recognizing the journeys, the paths are very different, and there is that sense of urgency because it literally is their life on the line for NBC. But it's also, as early stagers, we shouldn't feel guilty for celebrating and having joy if we have entered that survivorship stage, because I had a very difficult time and I actually still struggle with a lot of permanent damage and side effects and fertility. A lot of pain has happened in my experience. But I'm also very informed, and unfortunately, I have had too many friends to be taken from NBC who are young, who have kids, or who don't have kids, and seeing what that does, and it's devastating. And so I think it is our patient right, and we really need to make sure that we're understanding what all information is out there and the different experiences, but making sure that we continue to uplift and amplify the plight of the metastatic breast cancer community.
100%. And man, that's so great to hear from you. I know when the first metastatic retreat I went to, they told me, don't cry. If you cry, you have to leave. And I was like, I'm not going to cry. I'm fine. I lost my mom to cancer. I'm like, I'm fine. So I go in there, and the first thing they do, they sit in a circle and they introduce each other. And I was shocked. The very first session, they talk about what line of therapy they're on. My dad was a pharmacist for 50 years, and one of the first things that they did was talk about the line of therapy, and not one person mispronounced the drug name, the generic drug, the drug name they were on, and the one they were going to be on. And I was like, what? All these people know how to say the chemistry name for the drug.
Yeah.
They know everything. And so we go around the circle, and the very last, so it was the patient and the caregiver, the female caregiver for this retreat. Sometimes it's the husbands and sometimes it's a female caregiver. And at this one, it was females. And so the very last couple, it was this beautiful young, probably 28 years old, and her mom. And so they got to the mom, and I was like, okay, I'm kind of going through the, I'm like, don't cry, don't cry. We get to the mom and the daughter, and I'm thinking, oh man, the daughter's going to lose her mom. Her mom's still so young to breast cancer. And the mom said, I'm just so sad that it's not me that has breast cancer. It's my daughter. And then I look over and I see, and it's her, and she's beautiful, and she's 28. She's a teacher. And I was thinking she was the caregiver to her mom. She was the patient. And I lost it, and then they kicked me out. So, yeah, it is. It's heartbreaking when you meet those young patients and they're out there, and you do have to talk differently to them, and you do need to understand and it's not just empathy, it's understanding.
Yeah.
So,
and the urgency.
Yeah, and urgency. Yes. Yep.
What can you tell us about the promoting health equity and ways to remove barriers to care? How does NBCF address those goals?
When I wrote a few blogs, we do have a really wonderful blog as well on our website, and I go into that a little bit. That is very important to us and very key to what we do. I feel like we've been promoting health equity. Health equity is kind of a buzzword now, but it wasn't, 10 years ago, 20 years ago. People weren't really saying that. But we've always been on it because we realize and we know that not everybody has equal access to care. Not everybody has I don't know what your journey was like, but not everybody has the same journey. But that's not right. It's just not right. We should all have equal access to care, to quality care. We should all be able to go on the same journey. I know everybody's journey is different. You have different stages or whatever, but you shouldn't have to go without because of your background, your ethnicity, your race, or your socioeconomic background as well. So we put a lot of effort into that. One of our initiatives that we launched a couple of years ago, the Latina Initiative, we know that Hispanic women are 30% more likely to die of breast cancer in the United States. And so we really want to reduce that number, as well as Black women are 40% more likely, up to 40. I think it may be going down. There's been so many efforts to get that number down as well. And I saw a recent report, and it looks like it may be trending down, which means we're doing something. We're all of us in this industry are on the right track. That's what we want to see. We want to reduce the mortality rate in those communities because that's what needs to happen. That's the right thing to happen. And it's hard work, but it's important. And it's going to take us, some years to do that. One of the ways that we do that is just simply by funding and making sure that there is investment into those populations.
And that is huge right there, right? I mean, that's one of the key things is seeing the value in these communities, one that I am part of. For those who are not listening to us and seeing the video, I am a Black woman, and I am a Black breast cancer survivor. And my experience was, I was not believed. My symptoms presented differently than what the guidelines show. And that's something I talk a lot about as we think about health equity is making sure that we get that message out that for those of us who are, you know, Black, Latina, Hispanic, Asian community, our symptoms may present differently. And so we really need to get our providers, we need to get researchers on board to recognize, you got to think outside the box because a lot of us are mixed with a lot of different things in there. And so it just could be different. And as we think about removing those barriers of health equity, a lot of that is first the acknowledgement that they exist and the investing into these communities to get the message out and to help build that trust, right?
Yeah.
Exactly, because it's like, I often think as a patient and when I talk to others in the different communities and then like younger people as well, like teenagers, as it's like there are ways to advocate for yourself, or here are questions that you can ask. And that's what I really love about NBCF, because you have questions that you can download, checklists that you can download. And that's helpful because, again, it's very overwhelming. Even getting a screening can be scary because you just don't know. And it may be from, a technician or someone who does not look like you. And so I think it's so important that we continue getting that message out and investing in these communities to build that trust in the information, right? This is not misinformation, but we also, have to address on our American history, specifically in these communities, and showing that we're doing everything we can to make sure that we all get access to quality care.
Absolutely. I mean, you answered that question way better than I could have. And two things that you said that just stuck out to me, and I had to learn this, by the way, and I think we should be okay with learning things. We don't know everything. We have to learn. I'm a white dude, so I got a lot of stuff I have to learn. So listen on the radio. But I think two things that you said, obviously, and I also said investment is important. But I always, a few years ago, for me, it was all about the investment. Like, we've got to put money into this. We got to do this. And I think I didn't see the part about building trust as much. Because if you're not in those communities, or maybe you don't know that your history well, you don't understand that trust. If somebody doesn't trust you or trust the work that you're going to do, they're not going to take what you give them. Mm-hmm. So you can invest in something, but if they don't trust where that's coming from, they're not going to accept it. So we have been really strategic about building trust in these communities so that people will say, oh, NBCF is telling me I can go here and get a mammogram in Miami and it's okay, even though some laws in Florida, sorry, not to get political, there's some new laws that could be a barrier to me getting a mammogram in Miami, but they said I can do it, and they've connected me with a navigator. They've connected me with the team there, and I'm going to be brought in, and it's going to be okay. So we have to build trust there.
Absolutely.
Too much.
No, I mean, we have to address the political landscape as well, because that is part of it, and I really love coming from a white dude of saying, hey, I had some learning to do, and I think just admitting that is so key. And that is why I would be like, you know what? Okay, because not everyone admits that they need to learn a few more things to understand and build that trust. And so I just feel that's very important. So I appreciate you saying that.
Oh, yeah. Well, and I got more to learn. So I'm still learning.
Right. Always learning, always learning. And that's what I'd love to, say too, is don't be afraid to ask questions.
Mhm.
And the more you reach to community leaders and, and of course the partners and cancer centers, etc., like that's what it's all about. Going through breast cancer, like I don't like to call it breast cancer awareness. I like to say this is breast cancer education, breast cancer action. And to me, that is what NBCF, NBCF is doing,
Yeah, yeah.
is about that education, but also the action.
Absolutely, because and that's why all those words are important, like trust, is because you trust what if you're educated, you do have the trust there, right? And you feel like you're informed now, and it's information you can trust. It's different than awareness because awareness is, and we did a campaign last October. Our marketing team will get mad because I'm going back to our old campaign, but last we it was called More Than Awareness, and that was the purpose of that is being aware of something is important, but then you have to take the next step, right? And
Yes.
be educated, be informed, and then take action, do something, get screened, um, when to get screened, follow up with if you're a patient and your doctor is telling you something and you feel weird about it or uncomfortable, get a second opinion. Um, if your team is you're not vibing with your team, go talk to somebody else. If you need to, if your mental health is if you're going through treatment and you're struggling with your mental health and no one's reaching out to you, get help, advocate for yourself. Get into a program where you get we have support programs at NBCF. Get into a support program.
So true. And I always like to remind people like you matter and that like this is your health and you matter. So it is important to be armed with information and act on it. And Doug, as we wrap up this conversation, I really just love the different initiatives that you've talked about, the different resources that you have talked about. I was wondering, what are some last words that you would love to leave our audience with as we think about not just breast cancer awareness slash education slash
Mhm.
action month, because this is all year round, you know?
Yep. Yeah, that's great. I think I think I should interview you. Yeah. Yes, it is all year round, and that is important to us as well. I mean, definitely visit our website if you have any questions about breast cancer, nbcf.org, or you need support or you need access to help. That's what we're here for. You can reach out to us. Help@nbcf.org is our email. I mean, anything that you need help with, we're here for you. But yeah, I think that's critical. And then reminding people that it is all year round. I think that's great. Um, and if your appointment's in October, November, go. But if your appointment's in February, go. Make sure. And if you're having an issue getting there or getting to treatment, let us know because we want to help.
Thank you so much, Doug, and thanks again to Oncology Data Advisors for, making this awesome and necessary conversation happen.
Thank you.